Well, it is July 7th at approximately 12:16 p.m. based upon the watch. So, if random were the norm, an ongoing series, this is me, Bobby B, the man who you'll be speaking with today. Today I wanted to talk more openly about therapy. Now, therapy doesn't need to be because it's cirrhosis and it's alcohol. Therapy doesn't need to revolve itself around the current situation that you're in. Therapy just needs to be considered. And I think everyone should consider it. Whether they think it's their cup of tea or not, try it once. Now, if you're perfect and happy in life and you don't need therapy in any way whatsoever, then never mind. This definitely isn't your topic. But for those of you who have had it before, such as myself, for those of you that are currently doing it now, such as myself, I start that tomorrow, so we'll let you know how that meeting goes. I'm going to be honest with you guys, therapy, and I'm going to move my camera so I apologize. Get a little closer, we can have a little more intimate conversation. As you can see, yes, still in the hospital, got a new IV, this time in this arm, because the other arm wasn't working too well, and it was not pretty. So there's my Spidey IV, as I call it, because if you turn, like Spider-Man. Yeah, cool like that. Anyways, back to my original comments that we're talking about right now. Therapy. Therapy's good for you. Therapy is something that can cause stress relief, worry relief, anxiousness, depression, anxiety. I guess anxiousness, anxiety, depression, mental health overall. It's absolutely perfect for. Whether you had childhood trauma, whether you had teenage trauma, whether you had pre-adult trauma, whether you had adult trauma, whether you have old people trauma, whether you don't have trauma but you feel like that you could be traumatic, or if you feel that you're dramatic and want to be able to handle things better. In other words, therapy is for just about anything you're looking for. Just like they have physical therapy for when you break your ankle, hurt your arm, collarbone, leg, things like that. Well, they also have mental therapy. And it's just a therapist. I'm not saying you need to go to a psychiatrist and take pills. Not by any means whatsoever. That's not for everyone. It's not for me. I'm not a huge fan of pills whatsoever. Therefore, a psychiatrist, while they sit and listen and do what they're supposed to do, they are somewhat drug-oriented versus a psychologist, which is who I love. And they just sit and listen and don't judge. They don't tell you what you're doing wrong. They don't tell you what you're doing right. They just want you to get out how you feel so that they can respond to see if they can put you in a better position to handle if the feelings that you're having aren't right. And like I said, that doesn't have to mean suicide. It can mean depression, anxiety, worrisomeness, failure, loss, anger, divorce, marriage counseling. I mean, any type of counseling you're looking for, it's out there. And everybody needs to take the time out to evaluate their situation and figure out if therapy is necessary. Again, it's not for everyone. I totally understand. I think it should be. I think it should be free and to anyone and everyone who needs it, but these doctors need to make money too. So, totally understand. Most insurance plans cover mental health, so keep that in mind. And there are a lot of mental health professionals that will have a standard, cheap, decent fee for the visits. I think there's one right now that's online for like $15, and you telehealth it too. You can talk to them over the phone. You don't have to go into an office and sit down in a chair or sit down on a couch and lay back and sit in the chair and then ask you questions and then then we give you all of these different tests. No, you just want somebody that you can go, hey, having a bad day. So this is what happened. This is what's going on. This is my situation. Can you help me? What can I do to reevaluate how I should be thinking about blank, blank, blank situation? It's a wonderful feeling to have somebody give you suggestions, not based upon what they think you can handle or can't handle, but more what, sorry, I don't know who that was. More so of it gives you a educated opinion and advice on what options you have available to yourself in order to help alleviate that blank, blank, blank issue, whatever it is, stress, like I said, suicide, depression, anxiety, worrisomeness, failure, loss of a family member, you name it. Like I said, it's out there. But I think therapy is a very, very, very important to probably 90% of this population. Whether you're rich, whether you're poor, that could be half the problem in your eyes. And again, another reason for therapy. But at the end of the day, I know money is an object to a lot of us. And I know not everyone has a lot of money, but there's ways to find free help. And I want everybody out there to just go out if they want to and search. If you're too worried to, or if you don't even know where to start, reach out to me. Ask me. Send me a message. I'll definitely walk you through what I can. I'll help anybody look for what they need. Therapy is that important, in my opinion, to life, that if any of you have any issues or questions, or you're worried that, therapy was just like a joke for some people, reach out, ask. It'd be my pleasure to sit and talk to you for a little bit. We can do it over the phone, we can FaceTime, we can just text, we can write through YouTube, it doesn't matter. But if you're on the fence about it, reach out. I'll push you one way or the other. It's all I know by giving you my own thought process. Is you're going to either fall off and go to one, or fall on and think you're better than that. So, sorry. Breakfast was blueberry muffins, and blueberries seem to be stuck in my teeth. Gross. Other than that, it was a good day. Blew 3 IVs. So this new one here that I was just showing you guys on the arm. This one. It's right there. Oh, it's hard to see. See, it's already bent up. My skin's already fat. Because they blew 3 spots today. I'm going to tell you right now, when they blow an IV, it hurts like hell. Hurts like hell. Again, maybe you're afraid of IVs. Maybe a psychologist can help. You never know. It's good therapy. Medical therapy is a good therapy too, because some of the stuff that they've done here to me, I question my reality as well. Because it's crazy. But just remember, guys, therapy isn't for everyone, but it is for most people. And if you take the time and you give it your all, and you don't look at it as a joke or something you have to do, but you look at it as a willing participant, I guarantee you're going to get something positive out of it. And the good part is, the person sitting across from you, listening to you talk, they don't know you. They're not judging you. They don't know your situation, nor do they probably really want to delve into it deep. All they want to do is be able to help you cope and get better at whatever's ailing you. So take the time, figure out if you really do need one, and if you do, reach out. Check with your insurance. If you're not sure where to start or what to do, reach out to me, and I'll be more than happy to walk you through the processes, and do as much as I can to help you out, because that's what we're supposed to do, is help each other out. It's pretty cool. We don't do enough conversationally between people. We don't do enough respectfully between people. We've kind of lost our way here. And it's time to just get back to, loving everybody and doing the best you can for everyone else, as long as you're happy. Now, if you're not happy, therapy. If it puts you in a better position in order for you to help someone else be in a better position, then you've won the day, which is why I offer help all the time to whoever needs it. Because I'm not looking for accolades. I'm not looking for thank yous and you're so great. I'm looking for, man, that really helped. Man, I can definitely breathe better at night, sleep better at night, because I took the time to actually do it. Like, trust me. So today's a 10-minute lesson as usual. Nothing to do really with the hospital. More to do with just don't forget to get yourself checked out. And that isn't medically, that's mentally. Go get yourself checked out. Make sure you're doing okay. And if you're not doing okay and you don't want to see a therapist, reach out to me. Reach out to a friend. Reach out to a family member that you trust. Because we're all here for each other. We should be. But I'm here for any one of you that need it. So with that being said, we'll go ahead and cut this for today. I'll probably make one more for tonight. And then tomorrow is another day in the hospital. But we're getting closer to Thursday to where I'll be released. So we'll see what happens. Anyways, it's great talking to you guys. I hope everyone's having a blast of a day. Bob out.